Hello, and welcome to today's presentation on what role can mindfulness play in addressing burnout. My name is Alyssa Anderson, and I serve as an assistant professor of athletic training and the clinical education coordinator at North Park University in Chicago. I did want to put out the disclaimer that I am not a mindfulness expert. In fact, I would describe myself as a mindfulness novice, and I find it challenging to integrate mindfulness into my own life. However, from a posture of learning, humility, and curiosity, I offer what I've learned about mindfulness and the potential that it has for helping athletic trainers mitigate burnout. So I do have a few people I'd like to acknowledge who contributed to this presentation. The first is my colleague at North Park, Dr. Chelsea Wooding. Chelsea is a certified mental performance consultant. We co-presented earlier this year at a pedagogical conference on incorporating self-care and wellness strategies into online and hybrid teaching. Dr. Wooding incorporated mindfulness techniques and led participants through them. And that's what really inspired me to develop this presentation. She also coached me a little bit on how to approach the techniques that I'll be facilitating today. And then the other inspiration for this presentation was an assignment I completed for my doctoral program. My instructor, Dr. Brody, encouraged me to pursue presenting and offered some feedback on my initial outline. I have no conflicts of interest to disclose. The views contained in this presentation are mine and mine alone and may not represent the views of my employer. So let's dive right in. Today's session focuses on examining the literature on work-life balance and burnout in the profession of athletic training, exploring mindfulness based on the literature, and then examining several strategies to improve work-life balance and mitigate burnout, including some mindfulness exercises. And then evaluating the role of mindfulness for athletic trainers' self-care. So I will warn you that today's presentation does involve some participation. It shouldn't be too hard, and hopefully it'll give you some strategies to take with you moving forward. The ultimate goal of this presentation is to offer mindfulness as a tool for athletic trainers to use in their self-care, and thereby it fits really well with Domain 5, particularly the professional responsibility element. I believe mindfulness also has great potential in Domain 1 with wellness promotion, since it promotes holistic well-being. And though this presentation is focused on clinicians, mindfulness can be integrated into patient care and then would be applicable to Domain 4. So to start us off, we're going to look at the literature on burnout a little bit. So burnout is a multi-dimensional concept. It often begins with high and sustained levels of job stress and then progresses to emotional exhaustion and detachment before culminating in decreased personal accomplishment. And along the way, there's often depersonalization of patients. So you can see those three listed there. And if you go back to the beginning, right? So thinking about high and sustained levels of job stress, stress often happens when situational demands outpace your ability to cope with or adapt to them. So stress and burnout are not the same. The big difference is that burnout has a specific work-related cause and specific work-related symptoms. And these symptoms can include chronic fatigue, insomnia, increased absenteeism, musculoskeletal aches and pains, migraines, digestive problems, loss of compassion and empathy, and frequent boredom. Now, you might be thinking to yourself, well, those are some really common symptoms. And that's one of the reasons that the different differential diagnoses here are depression, PTSD, and chronic fatigue syndrome. Again, the thing that really sets apart burnout is that it's related to your occupation. Okay. And burnout can lead to lower work quality. And this is concerning for our patients because if our work quality is decreased, it likely means that our patient care is decreased and our patients' outcomes are going to be decreased. Burnout can also lead to increased substance use and increased depressive symptoms. So what do we know from the athletic training literature specifically? Well, the causes of burnout in athletic training have been linked to work-life conflict, role strain, and challenges with professional socialization. And we're going to dive into each of those a little bit. So the first one is role strain. And there's lots of different types of role strain. I'm going to give you a brief overview of the different types. The first is role ambiguity. And this is when there isn't a lot of specificity about your job responsibilities. And so it leaves you with a sense of what it is that I'm supposed to do and what's not under my control. Role conflict is when you have multiple roles that don't seem to work together. So maybe you're an athletic trainer and an equipment manager, and the responsibilities for both of those positions have conflicts. Or maybe, some of your administrative responsibilities or meetings that you have to attend are at the same time as a pre-practice or a practice. And so it's hard to be in two places at once, and you would feel role conflict. Then there's role incongruity, and this is when expectations, right, your employer's expectations aren't compatible with your own value system. There's role incompetence, which is when one doesn't feel prepared for their role, typically in terms of knowledge or skills. So our young professionals in particular might be suffering from this in terms of that transition from being a student to being certified and not quite knowing all of the information that you think you should know. And then the last one, and probably the most prevalent, is role overload. And this is when the requirements or responsibilities exceed your available time and energy. And if you think back to burnout and that definition that we looked at there, right, that you have high and sustained levels of job stress, right, where there's situational demands that outpace your ability to cope with them. And then you have role overload, where there's too many things and you don't have time to get them all done. Those kind of compound on each other. So there's a lot in the literature about role strain and how it ends up causing burnout in athletic training. Another cause is work-life conflict. In the earlier literature, this was referred to as work-family conflict. But more recently, we've tried to be more inclusive and holistic in how we describe this. And work-life conflict is exactly what it sounds like. Your job responsibilities and your personal obligations and desires aren't compatible, or they're conflicting with each other. Given the cyclical nature of a lot of athletic training positions, sometimes of year, there can be high conflict, whereas other parts of the year, there might not be much conflict at all. And so that's something that, depending on the setting that you're in, you may feel more prominently in certain seasons. If you're in more of a consistent work environment, like an industrial setting or a clinical setting, you might not you have more consistent work-life conflict, perhaps. And then an emerging theme in the literature, but doesn't have quite as many studies sort of supporting it or really focusing on it, is challenges with professional socialization. So trying to get people to feel like they're part of the profession and used to what it's like. And so when that doesn't happen well, that can contribute to burnout as well. So there's associated physical, emotional, and behavioral concerns with burnout. The literature reports these as things like headaches, high blood pressure, weight concerns, sleeplessness, fatigue. And then in terms of behaviors, there is a recent article that focuses on substance use, particularly looking at binge drinking, energy drinks, and tobacco use to see how does the prevalence of those behaviors in athletic training relate to the general population and to other healthcare providers. And it was found that binge drinking was much higher in athletic training than in those other groups. And then ultimately, burnout can lead people to leave the athletic training profession, and that's not something we want. So this has been sort of the doom and gloom part of the presentation. Now we're going to kind of shift into talking about work-life balance. So work-life balance involves effectively managing one's paid occupation and those personal activities and relationships important to one's well-being in order to reduce conflicting experiences. And that's straight from the NATA position statement on work-life balance that was published in 2018. Within that statement, there was also this really great quote to talk about the practices used to facilitate the successful fulfillment of the responsibilities associated with all roles one may assume. And there's a really big tie between work-life balance and a quality of life. So just as we want to improve quality of life for our patients, we also need to be aware of and invested in our own quality of life and work-life balance. So we're going to look into this position statement with a little bit more detail. So when we're looking at position statements, they grade the evidence or make recommendations based on the evidence on a grading scale. So it's an ABC scale. A C means that it's really just expert opinion. There's not a lot of data to support that recommendation. B-level evidence has some emerging studies, but there might be a little bit of conflict. So it's sort of a moderate recommendation. And then A recommendations have a lot of literature and a lot of good support. And so they're more of a high level of recommendation. And so the work-life balance position statement only has one A-level recommendation, and it's to adopt a work-life enrichment philosophy as a means to achieve work-life balance. Positive experiences in one role can enhance the quality of life in another role. Individuals who are satisfied with work and personal roles experience greater overall well-being. And if you're anything like the new cohort of students I taught this summer when we went over this position statement, you're probably thinking, well, this is common sense and it doesn't really say anything. But let's take a minute and break it down a little bit. So one of the reasons that it's so challenging to have really specifics about work-life balance is that we're also unique and we have different roles, we have different responsibilities, we have different value systems. And so there's not a one-size-fits-all formula for how to maintain work-life balance. It looks different for everyone. But the recommendation is here to be thoughtful and reflective about what is important to you and what you need, so that all of the different roles that you have can be fulfilled. The other thing I really think is important is when we're looking at work-life balance, we're not trying to keep it like this, like a balance beam or a teeter-totter. Sometimes there's that fluctuation. The big thing is that you don't want to continually be with one side really high and the other side really low and have giant swings, right? So trying to keep it more here, where there's times when your work might supersede or be the precedent or the priority. And there's other times when your other life obligations might be of higher priority. But how do you kind of keep those in balance a little bit more? And then there's a lot of other strategies that were recommended by this position statement. There's a lot here. I want to focus on the individual strategies since that's what you can control for yourself. However, if you also supervise athletic trainers, I'd encourage you to dig into the position statement a bit more and see which of these suggestions you're already doing, because I'm sure you're doing some of them, and which ones you might try to implement to improve quality of life and life-work balance for your employees. But on the individual level, right, let's kind of go down through these. So we have this idea of setting boundaries being really important. Again, it's probably like, well, obviously, Alyssa, setting boundaries is important. But I think that goes hand in hand with the next one, which is prioritizing daily tasks. And the position statement doesn't just look at your work tasks, but it also thinks about the tasks that you need for yourself. So prioritizing your lunch or your dinner time, prioritizing your workout time, prioritizing the phone calls you need to make for scheduling appointments or following up for things for yourself, right? And so prioritizing those and setting boundaries around those things, as well as around things like treatment times or drop-in hours or those sorts of things. Thinking about effective communication so that people know what your boundaries are and know what your priorities are. Being proactive towards your goals. I talked about this in terms of both personal and professional goals so that you have a plan of action of how you will address those things. Negotiating your role, so being clear about what your skills are and how they might play off of the other people that you work with. So maybe there's a role that someone else should have because they're better at it, or it's really something that's draining for you. So trying to negotiate which responsibilities you hold. We're going to come back to the two asterisk ones. So creating support networks, separating work and personal roles, being a team player. And then we've already talked about adopting a work-life enrichment philosophy. But then I want to focus here on the disengaging from the AT role and the healthy lifestyle practices, because I think that's really where we're going today with this presentation, is to think about what is one option of a way to disengage from your role in a healthy way, and then create your own practice of mindfulness as a way to focus on your own well-being. Okay. So the literature also has some strategies to mitigate burnout, right? And they're similar to the ones for work-life balance. Like I said before, individual and unique factors really impact the experience of burnout. So it's sort of a weak spot in the literature because it's hard to make generalizations. There's more focus in the burnout literature on organizational and environmental changes that can modify risk. So things like the supervising athletic trainer modeling work-life balance, or professional support systems, or staff cooperation, or adequate staffing, right? Things that make sense to us. But there is some emerging literature, some anecdotal evidence that religious and spiritual coping mechanisms can be helpful for the individual, or just individual practices. And so here's where I'm going to suggest that mindfulness might be a good option for a few reasons. It's cheap, it's easy to try and implement, it has good outcomes. You can kind of do it anywhere. And so that's kind of how we're going to segue into our focus on mindfulness today. So what is mindfulness? It's really about observing both your mind and your body. It's become more mainstream in the last few decades. Previously, it had pretty strong cultural and religious affiliation, but now it's pretty commonplace or pretty universal. It focuses on intentionally observing oneself and trying to cultivate an awareness that's non-judgmental. And that's a piece that can be really hard for people, is they're like, okay, I'm being intentional, I'm observing what's going on, but it's hard for me not to judge that experience. The other thing that's challenging about mindfulness for some people, particularly athletic trainers, is that the focus is on being rather than doing. So it's not, something to check off your to-do list. It's not a means to an end. It is in and of itself. So there's a big focus on being. And there's 7 main principles that guide mindfulness practice. So the first, as I've mentioned, is that non-judging spirit. So becoming aware of the automatic judgments that your mind makes, and not getting caught up in your own opinions, right? So letting it kind of wash over you, being aware, and then letting it go. There's the idea of patience. So giving yourself room to experience what you notice. Accept that your mind is going to wander. Our attention span is not very high, and it's not supposed to be, but really being open to the moment. The idea of the beginner's mind, and quite frankly, that's the reason that I felt comfortable sharing this with you today, is that mindfulness really focuses on the beginner's mind, a mind that's willing to see everything as it is for the first time, being free from the expectation of past experiences. So really that spirit of humility and curiosity. Then we have trust, which mindfulness describes as honoring your feelings and intuition. Trusting in oneself. Non-striving refers to not the fact that you're not focused on the result, but you're concerned about the process, so that you don't really need to do anything. You just need to be present. Acceptance is seeing things as they actually are in the present moment and trying to be fully in the moment as it is. And then letting go describes this feeling of non-attachment. So you're not evaluating or ignoring the good or the bad, but you're just aware of both. And one of the easiest ways to see the connection with letting go is it's something we have to do before we go to sleep. And so particularly if we think back to insomnia being one of those symptoms of burnout, if you're having trouble sleeping, or sleeplessness, right? Both of them, If you're having trouble sleeping, mindfulness might be a way to allow your body to let go so that you can sleep. So that's kind of the broad overview. Now, why practice mindfulness? The three big things that come out of it are a clearer mind, the opportunity to process trauma and facilitate healing, and as a support for holistic well-being. So I would like to suggest that the last 2 years have been traumatic, for everyone, but both for athletic trainers and for our patients, between heightened racial issues, concerns about civil rights, abrupt halting of sports and academics, disability and the death toll from COVID-19, financial crises, mass shootings. We've experienced trauma. And as our very own Tanya Marquez keeps advocating with AT Cares, COVID-19 has been a crisis. And so opportunities to process trauma and facilitate healing are particularly relevant in our current context. So I'm not trying to suggest that mindfulness is the end-all be-all, but I do think that it's another tool for your toolbox, both for yourself, which is the point of this presentation, but also for your patients. So before we dive into some different mindfulness practices and look at the literature about mindfulness specifically, I did want to orient you to some of the key terms that you might see. So the first is mindfulness-based stress reduction, or MBSR. This is one of the most well-known applications of mindfulness for healing, particularly of chronic pain. So it was developed at UMass Medical School's Center of Mindfulness in Medicine, Healthcare, and Society. The founder was Jon Kabat-Zinn, who is also one of the names you'll see a lot in the literature about mindfulness. So MBSR is an 8-week course. It has a different focus each week. It began in the 1970s. It has group sessions as well as individual practice. So again, it was started for chronic pain, but it can also help with burnout and establish a deeper connection to the mind and body. So I think there's a lot of cross-application here. You may also see or read about mindfulness-based cognitive therapy. This is when cognitive behavioral techniques are combined with mindfulness strategies. And then 2 outcomes measures that I wanted you to be aware of are the 5-facet mindfulness questionnaire, or the FFMQ. This is a self-report scale, so individuals answer statements that correspond to observation, descriptions, awareness of actions, non-judgmental inner experience, and non-reactivity. And then the Mindfulness Attention Awareness Scale, or the MAS, is a 15-item scale designed to assess open or receptive awareness of and attention to what is taking place in the present. So both of these are used to assess the effectiveness of mindfulness interventions. And so I'll refer back to them as we look at some of the literature later today. But we're going to, as I mentioned earlier, part of this presentation is giving you the chance to experience mindfulness practices. And so the first one that we're going to try is a body scan meditation. And during a body scan, it's really the connection from the mind to the muscle. So the mind is guiding this process. Your brain is checking in with your body, but you're not changing anything. This is particularly helpful if you have compensation or activity restrictions or contraindications to certain movements, because again, you're not changing anything. You're just becoming more aware of how your body feels. So what I would like you to do, if you're willing, is to get yourself really comfortable. You can choose what position this is. You could be standing, seated, against a wall, laying down if you wanted to. I'm going to ask you to find some calm. Allow your eyes to close or remain open with a soft gaze, whichever feels more comfortable for you. We're going to start by taking several long, slow breaths. focus on breathing in through your nose. Have your stomach expand and relax as you exhale through your mouth. Begin to let go of the outside noises and turn your attention inward. If you get distracted by the noises around you, simply notice this and then bring your focus back to your breathing. Slowly bring your attention toward your feet. Begin observing the sensations. Just notice without judgment. Feel free to wiggle your toes a little bit. You might imagine sending your breath down to your feet, as if it is traveling from your lungs through your core and legs to your feet and then back up through your lungs and nose. Perhaps you don't feel anything, and that's fine too. Just notice. Try to stay present to what your body is telling you. When you are ready, allow your feet to dissolve in your mind's eye and shift your focus upward. Again, if your mind begins to wander, gently notice this without judgment and bring your mind back to noticing sensations. If you notice discomfort, pain, or stiffness, don't judge this. Simply notice. Observe how these sensations shift and change from one moment to another. No sensation is permanent. You should be softening and releasing as you breathe in and out. Become curious about the sensations you're experiencing. Perhaps you notice the feeling of your clothing, or the process of digestion, or your belly rising and falling. If you notice opinions arising about these areas, gently let them go and return to noticing sensations. On your next out-breath, shift the focus to your hands and fingertips. See if you can channel your breathing into and out of this area as if you were breathing into and out from your hands. If your mind wanders, gently bring it back to the sensations in your hands. You might notice some differences between your right arm and your left arm. No need to judge this. As you exhale, you may experience your arms soften and release tension. Continue to breathe and shift focus to the neck, shoulder, and throat region. This is an area where we often hold tension. Be with the sensations here. It could be tightness or rigidity or holding. You may notice your shoulders moving along with the breath. Let go of any thoughts or stories you're telling about this area. As you breathe, you may feel the tension rolling off your shoulders. As you come to the end of this practice, take a full, deep breath, taking in all the energy of this practice, and then exhale fully. And when you are ready, open your eyes and return your attention to the present moment. So hopefully that experience gave you an appreciation for what a body scan meditation might feel like. There's many different ways to perform them. As I said at the beginning, there's many postures you can assume. There's different lengths of practice, but just an option for you. So we're going to shift our attention a little bit and dive into the literature about mindfulness. So in the literature, mindfulness has the potential to decrease pain, improve the healing process, prevent deterioration of performance. It also can holistically support a patient's well-being and improve the well-being of providers. You'll notice that I've highlighted the well-being of providers since that's the focus of this presentation. But I want to acknowledge that just as it could help patients with decreased pain or the healing process or performance, many athletic trainers deal with those same things, right? We experience pain, we are healing from injury, or we're trying to maintain our performance. And then holistic supportive well-being, even if it's not geared toward the provider specifically, we're people, and people benefit from mindfulness. But we're going to hone in on what does mindfulness do for providers or for athletic trainers. So as we discussed, one of the main causes of burnout is role strain. And so mediating the effects of role strain is key, and mindfulness can help mediate those effects. Burnout can show up as emotional exhaustion and leads to depersonalization of our patients, and mindfulness can help with emotional regulation. And the last one is healthy detachment is closely related to boundary setting, which we discussed as a strategy to help maintain work-life balance. And so mindfulness can help us, it can be a healthy detachment strategy as well. So the specific literature evidence that looks at providers. The first one is a 2016 systematic review looking at mindfulness-based interventions in the workplace. There were also some non-intervention studies included here as well, but they really focused on mindfulness and how it impacts someone's job. So criteria were that participants had to be currently employed in a healthcare context. And then the outcomes they looked at in the studies were measures of mindfulness, well-being, or job performance. Studies had to be empirical, published in Impress, and published in English. So in the 81 articles that they pulled for the systematic review, there were a variety of healthcare providers in the studies. So 9 studies focused on physicians, 16 focused on nurses, 4 looked at disability professionals, 24 looked at therapists, counselors, and psychologists, 8 looks at mixed or non-specific mental health professionals, and then 20 looks at mixed or non-specific healthcare providers in general. And so I offer that in that almost a third of the studies had a mix of healthcare providers who may have similar job roles to athletic trainers. The article was not specific if any of the studies looked at included athletic trainers, but I think there's a lot of parallels here. So of the 81 articles, 66 were intervention studies, 15 were non-intervention. They use different types of mindfulness programs. So the Mindfulness-Based Stress Reduction, or Mbsr, was used. Resilience training was used, and there were a few others. And then they used the MOS and the FFMQ for measurement to see what impact these interventions actually had. And so you can see the overview of results, and I'm going to orient you to those a little bit. So there were 38 studies that looked at the relationship between mindfulness and awareness. In general, there was improvement. So that happened in 26 of the 38 studies. There was a benign association, so not clearly improvement, but probably in 6 of the 38 studies. And then in 6 studies, no change was found. Then anxiety was reported in 16 of the studies. In 9 of those 16 studies, mindfulness intervention showed improvement on anxiety. 6 studies showed no change, and 1 study did show worsening anxiety. And then in the non-intervention studies, there was an inverse relationship between mindfulness and anxiety. So as mindfulness increased, anxiety decreased. Then we looked at depression. So 18 studies looked at it, 10 of which registered significant improvement. 7 had no change, and 1 had a benign association. In 37 studies looked at stress, 25 of which showed significant improvement, 12 showed no change, and 1 showed worsening. And again, in the non-intervention studies, there was an inverse correlation between stress and mindfulness. So more mindful, less stress. Looking at burnout specifically, there were 22 studies that looked at this. Half of them registered significant improvement, and then the other half showed no significant change. Of the ones that showed improvement, the biggest improvement was on emotional exhaustion as compared to the other constructs of burnout. So not as much impact on the depersonalization and not as much impact on the personal accomplishment. And then 27 studies looked at well-being outcomes more generally. 13 of them had a significant change, 14 had no change. So if you were paying attention, you notice that 2 studies had negative results. So for both, one was from the anxiety studies, one was looking at stress, and they found that likely there was an increased awareness with the mindfulness intervention, but the individuals were unable to maintain the non-judging disposition in light of that increased awareness. And so that might heighten their stress or anxiety. So said another way, you're doing a mindfulness intervention, so you're more aware of what's happening. And instead of having that non-judging spirit and just letting it kind of roll off your back and move forward and just being attentive or noticing the present, they were holding on to those feelings and judging them, which then caused their stress or their anxiety to go up. Okay, but that was in one study out of 16 in the case of anxiety and 37 in the case of stress. So really small risk of negative impact and pretty decent potential for positive impact, because most of the other studies either saw no significant change, so didn't get better, didn't get worse, or it saw significant improvement. The other thing I wanted to draw your attention to is the 2, both anxiety and depression. There was a medium effect size reported in the study. And then for burnout, there was a small effect size. All the other outcomes that were reported had a small to medium effect size. So not drastic, but noticeable. The other study I wanted to highlight was specific to athletic trainers. So this one looked at how athletic trainers have experienced mindfulness. It was done via a cross-sectional study or a cross-sectional survey, which was sent to an expert panel to establish its content and face validity. And then retest was done to establish reliability. Over 500 athletic trainers completed this survey. It was about a 10% response rate, which in survey research is not bad. And what did they find? Well, 86% of respondents reported some personal use of mindfulness. Greater personal use was reported by female identifying individuals, those not in a committed relationship, and those without children in the home. 81% of athletic trainers responding reported some incorporation of mindfulness into their patient care. Incorporation into patient care was higher in emerging settings and collegiate settings rather than the secondary school setting. That's not to deter those of you who work in the secondary school setting. It's just of the respondents, not as many had used mindfulness in that setting. Emerging settings also found greater incorporation than clinical settings. Overall, athletic trainers found mindfulness more important for their own self-care rather than for patient care. This was more pronounced in certain demographic groups, which matched National Health Institute records data. So female identifying individuals, African American or Black individuals, individuals with children in the home, without children in the home, and those 20 to 30 and 30 to 40 more so than those 40 to 50. So there were some limitations in this study. Data was collected during the height of the COVID-19 pandemic, so there were some lower response and completion rates than they had hoped. There was also concern for response bias, because if someone is more excited about mindfulness, they're more likely to take a survey about mindfulness. It's a cross-sectional survey, so it's only one point in time, and they didn't collect any geographic data, so it's unclear if certain areas of the country incorporate mindfulness more than others. So the study advocates for brief techniques, or the ATs who were surveyed reported that they used brief techniques more so because there were fewer barriers and there was easier integration into practice. So some common practices reported were progressive relaxation and breathing, which we're going to do here in a little bit, and then body scanning, which is what we've already done. And that's part of the reason why both of those practices were incorporated into this presentation. Okay, so now we're going to go and try another mindfulness practice, mindful moving. So for clinicians, this can be a way to get what you need. It could be stretching, it could be walking, it could be standing. I'm going to direct it a couple of different ways so that you have options to fit your space and your preferences. The keys for all the variations is to notice and listen to your body. So while I would encourage you to follow along with these practices, you may have limitations due to space or ability. So please be cognizant of those realities to keep yourself safe. So we're going to do 3 different ones. We're going to start with a seated stretch. So first, put yourself in a position with good posture. I'm going to do that myself. And I'm going to, as I cue you through some basic movements, I want you to focus on noticing, not to judge what you feel, but to become more aware of your body. And I'm going to ask you to reach your arms overhead, remembering to breathe as you do so. Then lean your arms and your upper body to one side, continuing to breathe. See what you notice. And then allow your arms to go to the other side of your body. Again, continue to breathe and notice. Allow your hands to drop to your sides. Then do some shoulder rolls. I'm going to do this one with you. Continue to notice. Again, don't judge, just feel. Then relax your shoulders and bring your chin to your chest. Notice how your neck is responding. Then gently roll your head from side to side, continuing to breathe as you do so. Again, try not to judge, but being more aware of how you feel. You could continue mindful stretching with other parts of your body, and you may notice similarities with yoga, which is considered a mindful stretching practice. But we're going to move on to another mindful moving practice option, standing. So if you have the ability and space, please stand and notice what you feel. Find a stance that is most comfortable for you and take a few deep breaths here. Then slowly shift your weight from side to side. Become aware of the sensations this brings up. Then return to your comfortable stance and take a few deep breaths here. Now we will transition to mindful walking. If you are limited by space, feel free to walk in place. To start, walk at a pace that is comfortable for you. And just notice, where do you feel weight? What sensations do you notice? If you find yourself judging these sensations, try to bring your focus back to awareness and curiosity. Where do you feel your breath? Do you notice the rubbing of your clothing or the feel of your shoes? Continue to breathe. What's coming up for you? Notice and refrain from judging. Just be aware of your experience in the present moment. Do you feel tension or the release of tension? As distractions and judgments arise, choose to come back to the present moment. Next, you're going to play with your speed. If you are comfortable, begin walking a little faster. and notice what happens to your thoughts. Continue to breathe as you're walking. Then relax your pace, perhaps even slower than your original. What do you notice now? Continue breathing. Continue being aware of how you feel. Just notice. And then I'll ask that you make your way back to your original position, so seated or standing, and we're going to wrap up this activity. So we've done a couple of mindfulness practices, and I'd like to acknowledge that there are some barriers and challenges. So time, resources, and knowledge or confidence are commonly cited barriers to mindfulness practice and implementation in the literature. And I thought this did a nice job summarizing it too. The training that you have, the staff that you have, or the support that you have, your own buy-in, those can all be barriers to implementing mindfulness. And so I wanted to provide you with a few resources depending on how you best engage. So there's some really great books on here. You will notice a couple of them are written by Jon Kabat-Zinn, who is the founder of the Mbsr program. But there's a few others. There's some apps that use mindfulness. So Headspace, Calm. I found a couple of podcasts for beginners. The other nice thing about those is that they're pretty short. So like the 12-minute meditation is 12 minutes. So when you don't have a lot of time, this might be a good place to start. And then if you're really interested, there's some mindfulness centers if you wanted to go through an Mbsr program on your own. But to wrap up our time together, we have one more mindfulness practice to try. This one is called progressive muscle relaxation, and it's almost the opposite of a body scan. So here you're going from muscles to mind, and you're building awareness of the tension that you have. For some of you, it might be really helpful to start here with mindfulness practices because you're actually doing something, right? You're going to squeeze and feel tension, but allow yourself to do in order to be present. One caveat is that sometimes progressive muscle relaxation is contraindicated. So if you have a restriction on a particular area of your body where you're not supposed to contract there, then you shouldn't do progressive muscle relaxation there. But you can do this for the lower extremity or the upper extremity or a particular body part. And so if you do have restrictions, you can kind of tailor it to what works for you. So as part of the progressive muscle relaxation, we're going to build awareness of tension. So many times you will contract the same muscle group multiple times during a progressive muscle relaxation to notice the difference in feelings. And so what I will ask you to do for this practice is that the first time you contract a muscle, I would like you to do it at 100% or as hard as you can without straining yourself. And then the second time we do it, I'm going to ask you to do it at about 50% intensity so that you can feel that change and become aware of that change in your own body. Okay, let's begin. I would encourage you to find a comfortable space. You can sit, stand, lie down, sit against a wall. Just find a position that's comfortable for you. Let your hands rest loosely in your lap or by your side. If you feel comfortable, I would encourage you to close your eyes. Become aware of your breathing and notice how your abdomen rises and falls with each breath. Now take a long, slow, deep breath in through your nose, all the way down into your stomach. Hold the breath for just a moment and then exhale through your mouth. Allow your breath to carry away all the stress and tension as the air floods out of your lungs. Take another slow breath in through your nose. Fill your lungs completely. Hold it for a moment and release the breath through your mouth. Empty your lungs completely with your out breath. Take a third deep breath in. Hold it for a moment and then let it go. Feel that your body has already undergone a change. The tension in your body has begun to loosen and subside. Now let your breathing rhythm return to normal and relax. During this relaxation, I will ask you to tense various muscles throughout your body. Please do this without straining. You do not need to exert yourself. Just contract each muscle firmly but gently as you breathe in. If you feel uncomfortable at any time, you can simply relax and breathe normally. First, I'd like you to bring your awareness to your feet and toes. Breathe in deeply through your nose. And as you do, gently curl your toes down and tense the muscles in the soles of your feet. Hold your breath for just a few seconds and then release these muscles. Feel the tension in your feet diminish as you exhale. Take another deep breath in. Again, tense the muscles in the soles of your feet a little bit softer this time. And hold this position for a few seconds. Now release. Feel yourself relaxing more and more deeply with each breath. Your whole body is becoming heavier, softer, and more relaxed as each moment passes. Now bring your awareness to your lower legs. As you draw in a nice deep breath, dorsiflex strongly. Hold for just a moment, and then let those muscles go limp as you exhale. Once again, draw in a deep breath and dorsiflex, this time with less intensity. Hold for a few seconds, and then let it all go. Feel your muscles relax and feel the tension washing away with your out breath. In a moment, you will tense your quadriceps. Take a deep breath in and tense your quadriceps as strongly as is comfortable. Hold this tension for just a moment and then release everything. As you do this, the blood flow to your muscles increases and you may notice a warm tingling sensation. Enjoy this feeling of soothing relaxation in your thighs. Again, breathe in deeply and tighten your quadriceps, this time at about 50% intensity. Hold for a moment and then release. Focus on letting your muscles go limp and loose. Next, we're going to turn our attention to your buttocks. So draw in a nice deep breath and gradually tighten the muscles in your buttocks as hard as you can. Hold this contraction for a few seconds and then release your breath. Feel the tension leaving your muscles. Once more, breathe in deeply and then softly tense the muscles in your buttocks. Hold for a moment. Now release them. You are becoming more and more deeply relaxed. Take another breath and this time gradually tighten all the muscles in your legs from your feet to your buttocks. Do this in whatever way feels natural and comfortable to you, but hold it with maximal intensity. And then release all these large, strong muscles as you breathe out. Now we're going to bring your awareness to your abdomen. So draw in a nice deep breath and then maximally tighten these muscles. Imagine you are trying to touch your belly button to your spine forcefully. Now release your breath and let your muscles relax. Notice the sensation of relief that comes from letting go. Once again, draw in a deep breath and with less intensity, tighten your stomach muscles. Hold for a few seconds and then let them relax as you exhale and release all tension. Now bring your awareness to the muscles in your back. As you slowly breathe in, tighten these muscles as much as you can. Now release your breath and let your muscles relax. Again, draw in a deep breath and then tighten your back muscles, not quite so hard this time. Hold for a few seconds and then let them relax and release. Now give your attention to your shoulder muscles and the muscles in your neck. As you slowly draw in a nice deep breath, elevate your shoulders and squeeze these muscles firmly. Then breathe out completely and allow your contracted muscles to go loose and limp. Again, pull your shoulders up towards your ears and squeeze these muscles partially. Then feel the tension subside as you relax and breathe out. On your next breath in, flex your elbow with maximal contraction. Hold that breath and that contraction for just a moment. And then gently lower your arms and breathe all the way out. As you flex your elbows again, gently tighten the muscles as you breathe in. Breathe in deeply. Now relax your arms and breathe out. Now bring your awareness to your forearms. As you breathe in, flex your wrists. Then feel the tension subside as you relax and breathe out. Again, take a deep breath in and tighten the muscles in your forearm again, though not as hard this time. And then release them. Feel the tension washing away. Now take another deep breath in and tightly clench your fists. When you have finished breathing in, hold for just a few seconds and then release. Notice any feelings of buzzing or throbbing. Your hands should feel soft and relaxed. Take another deep breath in and softly clench your fists again. Hold for just a few seconds and then release. Let your fingers go limp. Your arms and hands are feeling heavy and relaxed. Now tighten the muscles in your face by squeezing your eyes shut and clenching your lips together tightly. As you do, breathe in fully. Hold it. Then breathe out and relax all your facial muscles. Now bring your awareness to the muscles in your jaw. Take a deep breath in and then open your mouth as wide as you can. Feel your jaw muscles stretching and tightening. Then exhale and allow your mouth to gently close. You should now experience a relaxed sensation throughout your body. Take a few breaths here and just notice. Try not to judge. Just be aware of how you are feeling. Breathe in and breathe out. Okay, and then return to the present so we can wrap up this presentation. So my hope is that getting a taste of a few mindfulness practices was helpful for you. Please know that there's lots of other mindfulness strategies out there. So if you're intrigued, but none of these quite fit you, keep exploring. And then just as a reminder of why this is important for us as athletic trainers, being aware in the present moment can help us mediate role strain. As we talked about, the life-work balance literature has a lot about this. Mindfulness is a healthy coping strategy that can help reduce stress and help us regulate emotions. This is particularly important if you're on your way to burnout, because that's one of the first things that goes is your emotional regulation. And then healthy detachment in that you're present to yourself. And so one thing I would like to offer is that this can be a really good, mindfulness can be a good transition exercise between work and home, between patient care activities, right? When you really kind of need both your mind and your body to switch from doing one thing to doing something else. So at the end of the day, my hope is that incorporation of mindfulness into clinician self-care may improve quality of life and work-life balance and help to mitigate some of the risk of burnout. I did want to draw your attention to one more thing, which is that currently the Journal of Athletic Training is seeking submissions for a special issue focused on mental health and well-being. And so I hope there are more strategies in that focused on clinicians. And how we can enhance our own well-being and potentially mitigate burnout. So submissions are due this fall, and I expect that it'll be published sometime in 2023. So be on the lookout for that. If you have any questions, please feel free to reach out to me. And here are my references. Take care.